Hello and welcome to our 5 on 5. I'm joined today by Director of the Oregon Health Authority, Patrick Allen. Thank you so much for making time to join us today.
Glad to be here.
Now, everyone is feeling and facing the impact of the Omicron variant. The head of the CDC has described it as mild, but the World Health Organization says it shouldn't be categorized that way. Where do you fit in, and how should we be viewing the Omicron, especially compared to Delta or the original strain?
Yeah, I really agree with what the World Health Organization came out with. I think it's less serious, but that's being conflated with mild. Many people will have a mild case, but that was true even of the Delta and other variants. What's going on is that with Omicron, you're less likely to be hospitalized or die from Omicron, it appears, but that doesn't mean zero. That means a smaller number. And so it's still a serious illness. And because it's so much more contagious, even if fewer people are hospitalized as a percentage, that number can still overwhelm our healthcare systems.
And speaking of hospitalizations, locally, our hospitals are nearly full and often can't discharge some patients because local long-term care facilities lack the staffing to handle them. In turn, that creates a backlog, takes up valuable bed space. Is the OHA doing anything to address this issue?
Yeah, a lot of things. We're working on providing extra staffing to long-term care facilities and dialysis centers, which are part of the same discharge system. We've created decompression units around the state, including in Southern Oregon, that we're staffing with traveling practitioners to be able to create more space to be able to have step-down care that can get people out of the hospital. But of course, the best way to avoid this are to do things like get vaccinated, get a booster if you're eligible, and wear a mask so that you're less at risk of being in the hospital to begin with.
And the other place we're seeing COVID's impact is in schools. Ashland recently going remote, other schools in Oregon canceling classes due to staffing issues and quarantine protocols. Has OHA advised ODE about the impact on school communities? What does that conversation look like?
Yeah, we work in close partnership with them as we have throughout the pandemic, and we have staff that are meeting almost constantly with their staff, and I meet regularly with Director Colt Gill of the Department of Education. We've worked with them on our test to stay programs that try to shorten quarantine periods. We just last week issued new quarantine guidance that lines up with new CDC recommendations about shortening the quarantine period to 5 days for people who don't have symptoms. And so we're trying to do everything we can. ODE's North Star, as they put it, is keeping kids in school, in person, all the time. There are certainly, as you've indicated, going to be times where that's just not possible because of staff shortages, but that really is the goal, to make sure we do everything we can to keep kids in school.
Absolutely. We'll be right back after this break. Welcome back to our 5 on 5. We're joined by the Director of OHA, Patrick Allen. Now, some have said that once we get through Omicron, maybe we're coming to the end of the pandemic. What are your thoughts? Are you as hopeful?
Well, I'm hopeful, but I've kind of also learned my lesson about making predictions about the pandemic. It really is hard to say what exactly is going to happen next. One of the most encouraging pieces of research that's beginning to come out, there have been studies at OHSU and also out of Israel, indicate that if you've been vaccinated and boosted and then have a breakthrough case, which is happening pretty commonly right now, but that induces a really high degree of immunity that may be protective against future variants. And so again, back to that general advice of the very best thing you can do is get fully vaccinated, including a booster, as the best way to help us all get out of this pandemic.
Now, obviously, it's been a very eventful few years, but more generally, how do you think Oregonians stack up in terms of overall health when compared to other states?
Well, we've come through the pandemic as one of the best performing states in the country. We have cumulatively the second lowest infection rate. We have the seventh lowest death rate. I think it's not a coincidence that 3 of the 5 lowest states for spread of COVID are also states that have had a high degree of mask requirements and those kinds of things. I think also Oregonians are on average a little healthier than the U.S. average, which helps. And so, I think long term, all the things that we want to do to be healthy as a state contribute not just to coming through a pandemic well, but dealing with influenza and other communicable diseases, and then chronic illnesses like diabetes and those kinds of things.
Absolutely. Is there anything more that you would like to share about work that the OHA is doing?
I think we're just working very, very hard to make sure that our healthcare and hospital systems are able to withstand this next wave as best they can. And again, I think the very best thing that people can do is what we've been saying for a long time, which is wear a mask and get vaccinated.
All right. Well, thank you so much for your time today, Director.
Thank you.
We'll be right back after this break.